Did you know that gestational diabetes affects about 10% of pregnancies? This condition, often silent and unnoticed, could be lurking in the shadows of what is supposed to be a joyous journey to motherhood. Gestational diabetes is a temporary condition that some women develop during pregnancy, characterized by higher than normal blood glucose levels. Unlike other types of diabetes, gestational diabetes is usually diagnosed in the second or third trimester of pregnancy and often resolves after giving birth. However, it requires careful management to prevent complications for both the mother and the baby. The exact cause is not entirely understood but is linked to hormonal changes during pregnancy that affect insulin's ability to manage blood sugar levels. Awareness and management of gestational diabetes are critical for several reasons. First and foremost, well-managed blood glucose levels significantly reduce the risk of pregnancy complications such as preeclampsia, preterm labor, and the need for cesarean delivery. For the baby, controlled maternal glucose levels decrease the risk of macrosomia, being born significantly larger than average, which can lead to complications during birth. Babies born to mothers with unmanaged gestational diabetes also face higher risks of developing low blood sugar levels shortly after birth and are at a greater risk for obesity and type 2 diabetes later in life. For the expecting mother, awareness means understanding the symptoms, which can often be subtle, and the risk factors, including family history of diabetes, obesity, and age above 25 years. Early detection through screening during pregnancy allows for timely interventions such as diet modifications, exercise, and, if necessary, medication. Education on monitoring blood glucose levels empowers women to take an active role in their health and their baby's well-being. The occurrence of gestational diabetes is largely attributed to the hormonal changes during pregnancy that lead to insulin resistance. During pregnancy, the placenta produces hormones that help the baby develop, but can also block the action of the mother's insulin, a condition known as insulin resistance. As a result, glucose levels in the blood rise, leading to gestational diabetes. This condition is more likely if the mother is overweight, has a family history of diabetes, is over the age of 25, or has had gestational diabetes in a previous pregnancy. The potential impacts of gestational diabetes on the mother include a higher risk of high blood pressure during pregnancy, an increased likelihood of developing type 2 diabetes later in life, and the possibility of needing a cesarean section due to the baby being larger than average. For the baby, gestational diabetes can lead to macrosomia, excessive birth weight, which can complicate delivery and increase the risk of injury during birth. Additionally, babies born to mothers with gestational diabetes are at a higher risk of developing low blood sugar levels after birth. Jaundice and type 2 diabetes in the future. Let's explore the three main symptoms you should never ignore. Symptom 1. Unusual thirst and increased urination. One of the hallmark symptoms of gestational diabetes is unusual thirst accompanied by increased urination. This symptom emerges as the body attempts to manage high blood sugar levels characteristic of the condition. When blood sugar levels are elevated, the kidneys respond by filtering out the excess glucose from the blood. This glucose is then excreted through urine, a process that requires water, leading to the depletion of the body's fluids and subsequently a cycle of dehydration and increased thirst. This increased need to urinate can become particularly noticeable and may disrupt the daily routine and sleep patterns of the expecting mother. Unlike the mild increase in urination frequency that is common during pregnancy, due to the growing uterus exerting pressure on the bladder, the urination frequency associated with gestational diabetes is primarily due to the body's effort to eliminate excess sugar. The mechanism behind this symptom is rooted in the body's basic response to high blood sugar levels. Under normal circumstances, the kidneys filter blood, reabsorbing glucose and returning it to the blood. However, when blood sugar levels are too high, the kidneys are unable to reabsorb all the glucose. This results in glucose being excreted in the urine, pulling fluids from the tissues, leading to increased urination. This loss of fluid causes dehydration, triggering the brain's thirst response to encourage fluid intake to replace what is lost. It is essential for expecting mothers to recognize this symptom, as it can serve as an early warning sign of gestational diabetes. Early detection and management of gestational diabetes are crucial to mitigate its impact on both the mother and the baby. Managing blood sugar levels through diet, exercise, and if necessary, medication can help control this symptom and reduce the risk of complications during pregnancy and delivery. Symptom 2, fatigue. Fatigue during pregnancy is a common experience, but when it's associated with gestational diabetes, it can take on a more pronounced form. Gestational diabetes-induced fatigue goes beyond the usual tiredness felt during pregnancy, presenting as a deep, often overwhelming sense of exhaustion. This type of fatigue arises not just from the physical and hormonal changes of pregnancy, but directly from the body's inefficient use of glucose for energy due to insulin resistance. In gestational diabetes, the body's cells do not effectively use insulin, resulting in high blood sugar levels. Normally, insulin helps glucose enter the body's cells to be used for energy. However, when insulin's effectiveness is reduced, glucose remains in the bloodstream rather than being utilized as fuel by the cells. This discrepancy leads to the body's energy demands not being met adequately, manifesting as fatigue. The expecting mother might find herself feeling unusually tired, even after periods of rest or minimal physical activity. This exacerbated fatigue can impact daily life, making it challenging to manage routine tasks or enjoy activities. It's not just physical tiredness. It can also affect emotional and mental well-being, contributing to feelings of frustration or stress during what is already a demanding time. Recognizing fatigue as a potential symptom of gestational diabetes is important for expecting mothers. It serves as a cue to seek medical advice and screening for gestational diabetes, especially if the fatigue is accompanied by other symptoms like unusual thirst and increased urination. Early detection and management of gestational diabetes through lifestyle modifications, monitoring blood glucose levels, and possibly medication can help alleviate this symptom. Symptom 3, blurred vision. Blurred vision during pregnancy, particularly when associated with gestational diabetes, is a symptom that should not be overlooked. This symptom arises as a consequence of high blood sugar levels affecting the fluid levels in the eyes, leading to changes in the shape of the lens and, consequently, vision impairment. Unlike the usual vision changes that some women may experience during pregnancy due to hormonal fluctuations, blurred vision related to gestational diabetes can signify that blood glucose levels are not being effectively managed. High blood sugar levels can cause the lens of the eye to swell, altering its shape and ability to focus, thus leading to blurred vision. This condition is temporary and often resolves once blood sugar levels are brought back to normal. However, it serves as a critical indicator of uncontrolled gestational diabetes and underscores the importance of monitoring and managing blood sugar levels during pregnancy. The impact of blurred vision extends beyond mere visual discomfort. It can affect an expecting mother's ability to perform daily tasks and can contribute to a sense of anxiety or stress. Moreover, if gestational diabetes is not adequately managed and high blood sugar levels persist, there could be long-term damage to the blood vessels of the retina, leading to more serious eye problems. Recognizing blurred vision as a symptom of gestational diabetes is crucial for expecting mothers. It necessitates prompt consultation with healthcare providers to assess blood glucose levels and adjust management plans accordingly. Gestational diabetes, if not properly managed, can pose several risks and complications for both the mother and the baby. Understanding these risks is crucial for expecting mothers to take proactive steps towards mitigating them. Risks and complications for the mother. Increased risk of developing type 2 diabetes later in life. Women who have had gestational diabetes have a higher chance of developing type 2 diabetes in the years following their pregnancy. Complications during delivery. Gestational diabetes can increase the likelihood of needing a cesarean section due to the baby being larger than normal. High blood pressure and preeclampsia. Gestational diabetes raises the risk of high blood pressure during pregnancy, as well as preeclampsia, a serious condition that can threaten the lives of both the mother and the baby. Risks and complications for the baby. High birth weight. Babies born to mothers with gestational diabetes are at risk of being larger than normal, macrosomia, which can lead to complications during delivery and increase the likelihood of a cesarean section. Low blood sugar, hypoglycemia. Babies of mothers with gestational diabetes may have low blood sugar levels shortly after birth, which can lead to seizures in the baby if not treated promptly. Risk of developing type 2 diabetes. Children born to mothers with gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Respiratory distress syndrome. Babies born early to mothers with gestational diabetes may experience respiratory distress syndrome, a condition that makes breathing difficult. Jaundice. Babies of mothers with gestational diabetes are more likely to develop jaundice, which is characterized by a yellowing of the skin and eyes. While jaundice is often mild in severe cases, it can lead to complications. Managing gestational diabetes is pivotal for the health and well-being of both the expecting mother and the baby. This management aims to keep blood glucose levels within a target range, thereby minimizing the risks associated with high blood sugar. Effective management combines lifestyle modifications, regular monitoring of blood glucose, and, if necessary, medication. Dietary changes. A cornerstone of managing gestational diabetes involves nutritional adjustments. This doesn't mean simply eating less sugar, but following a balanced diet that stabilizes blood sugar levels. Expecting mothers are often advised to work with a dietitian to create a meal plan that focuses on moderate carbohydrates, high fiber, and lean proteins. Frequent small meals throughout the day, along with healthy snacks, can help maintain steady blood sugar levels. Physical activity. Regular moderate exercise is another crucial aspect. Physical activity helps lower blood glucose by moving sugar into the cells, where it's used for energy, and by increasing the body's sensitivity to insulin. Activities such as walking, swimming, or prenatal yoga can be beneficial. But it's important to consult with healthcare providers before starting any exercise regimen during pregnancy. Blood glucose monitoring. Keeping a close eye on blood sugar levels is essential. Expecting mothers with gestational diabetes will need to test their blood sugar several times a day, typically before and after meals. This monitoring helps track the effectiveness of dietary and lifestyle changes and determines if medication is needed. Medication. If blood sugar levels remain high despite dietary and lifestyle changes, medication may be prescribed. Insulin injections are the most common treatment for gestational diabetes that cannot be controlled through diet and exercise alone. In some cases, oral medications are also used. Education and support. Understanding gestational diabetes and knowing how to manage it is vital. Healthcare providers can offer valuable education and resources. Support from healthcare professionals, family, and friends can also play a significant role in managing gestational diabetes effectively. In conclusion, gestational diabetes is a manageable condition that requires awareness, early detection, and proactive management to safeguard the health and well-being of both the expecting mother and her baby. Recognizing the symptoms, such as unusual thirst and increased urination, fatigue, and blurred vision, is the first step towards timely intervention. By adopting a healthy lifestyle, including a balanced diet and regular physical activity, closely monitoring blood sugar levels, and following medical advice, expecting mothers can effectively manage gestational diabetes. It's imperative for pregnant women and those planning pregnancy to attend all prenatal appointments and screenings. These checkups serve as critical opportunities for healthcare providers to detect any signs of gestational diabetes early on and to provide the necessary guidance and treatment. Empowerment through education about gestational diabetes can also inspire positive changes that extend beyond pregnancy, promoting a healthy lifestyle that benefits both mother and child in the long term. Remember, while gestational diabetes presents challenges, with the right support and management strategies, it is possible to enjoy a healthy pregnancy and deliver a healthy baby. The journey of pregnancy, though complex, is immensely rewarding, and taking steps to manage conditions like gestational diabetes is a testament to the enduring strength and resilience of expecting mothers.